This is part 2 of the urinary system for medical terminology. We are beginning with the urinary catheterization portion of this particular chapter. So what you see here on the screen is an indwelling catheter that can be placed into the bladder and left there for several days as needed. Typically, if you have a patient that is staying in the hospital, they will have an indwelling catheter. Sometimes they're discharged with this indwelling catheter and they have a leg bag that they can be ambulatory, meaning they're moving around, and still keep that bladder controlled with that catheter. Then you do have patients that have catheters that are in and out. And basically all we're doing is we're going up into the bladder, we're introducing that catheter into the bladder in order to relieve the bladder of the urine. Maybe sometimes because the patient can't get up and down due to an injury or recuperating from some type of illness, or the bladder is not emptying on its own. You probably have heard the commercials that are online and actually on TV where patients do self-catheterization, and that is not something that sounds very pleasant, but it does have to be done with a lot of our patients that have bladder issues. So it's something that unfortunately we do have to talk about. We have patients that come into the clinic all the time and they have their own different catheters that they've brought with them, and they sometimes need assistance catheterizing themselves. Now, this is not something that we teach in our program, so your physician might be the one that has to help with that if you're not trained to do that, or maybe one of the other medical assistants or nurses in the office would help with this particular procedure. So there's different types of catheters. None of them sound pleasant, I understand, but they are necessary. Most of those catheters go through the urinary meatus up into the bladder, but there are some that have to be surgically implanted through the abdominal wall or through the wall of the back of the patient. And you can see some of those even here in the pictures that I've got on the screen and within your textbook. So yes, none of those look pleasant. However, it is necessary for some of those patients. These are also different types of methods that we can use with a needle and syringe in order to obtain a urine specimen from a patient that may be in a trauma situation or something a little different that we might need to just get that specimen and carry on. Some of the other types of procedures and tests that can be done, cystometers can be used in a process called cystometrography. That's how we break that down by the different word parts. Cystometrography, and remember that's the process, the meter is the specific instrument. Very good. Then you also have electromyography, where we're obviously using different procedures to look at these urinary bladders and the kidneys. Excuse me as I stumble through some of these words. I apologize. I'm trying to make sure that I get every little bit to you. The picture that you see here is a nephrotomography, which is a nephrotomography, and this is basically showing you can see the spine because that's a little bit more dense. Then you also see the kidneys here. Those are these little blob looking areas, and that's because we've used a little bit of contrast medium, not a whole lot. This is a really good picture with a IVP dye used, and what we see here are the urinary these are these tubes that lead from the kidneys and go down to the bladder. The ureters, very good, very good. So we can see these ureters very well here in this picture because we've used some contrast media. And then in this particular picture, we are seeing another type of process using IVP dye, and this is really highlighting everything within that kidney, all the veins and arteries. But we see some stenosis right here at this point where the actual arrow is pointing to. So that means that it's all tightened and stiff and there's not any urine that's able to pass through there. So obviously that means we are going to have some problems with that patient. So all kinds of different types of procedures there. The cystoscope is used in the cystoscopy, which we typically just call cystos, and we use the scope to go down into the bladder. Remember, cysto is bladder, and this is very, very common, very routine in the office and the operating room, where we can go in there and see what's going on inside that bladder. Now, no, it does not look pleasant, but the patient is sedated and they don't feel the pain of that. Okay, this is nephroscopy, where we can take a nephroscope and go in and look at the kidneys, but this is a little bit more invasive, where we have to make an incision into the patient's skin, go through all those tissues to get down into the actual kidney. So this would be the back side of the patient, because remember, those kidneys lie on the back side or the dorsal aspect of our patient. Moving into pathologies, very, very common words that we are going to see, especially with our patients that are coming in with a UTI. Dysuria, or some people say dysuria, same difference, but remember that the dys means difficult, so this would be difficult urination. Polyuria, which means poly is the many, so this means that the patient is going a whole lot more frequently. Then we go to the opposite end of the spectrum with anuria. A and an, remember, those mean no, not, or without. So this patient would not be urinating, which is really not good. Oligmenorrhea just means scanty or very few. Polyuria, remember poly, remember a lot. Nocturia. This one you probably know about, especially if you get up at night to go urinate. Noct, N-O-C-T, means night. So this is not a very bad situation for most patients that are used to getting up at night to go to the bathroom, but for several patients it is a problem because they're used to sleeping through the night. So when they have to start getting up at night to go to the bathroom, that poses a problem because it interrupts sleep. Then you have urgency, frequency, hesitancy. Those are all very self-explanatory, but you've got to remember these are very important terms that you must document whenever you are making an entry about a patient that is coming in with any type of urinary tract infection signs and symptoms. Another term that's not on here that we'll get to is hematuria. Remember, the hemato meant blood, so this would mean that the patient has obvious blood in the urine. And sometimes that's not obvious. We have to see that on the microscope or maybe in that UA dip that shows us that they have some blood in the urinary. Now, going over to urinary reflux, we talked about in the digestive system, gastroesophageal reflux disease, that GERD. Well, there is a reflux in the urinary system, and basically the same thing happens. Excuse me. The urine is supposed to flow down that ureter, but if it goes down and then tries to come back up, then that's what we typically call urinary reflux. It even can happen down in the urethra. Those tubules are only meant to go down with the urine. So if it goes back up, remember this is a waste product, so if it goes back up, then that means that there's some infection that has a potential to begin there in that area. Polycystic kidney disease, very scary terms. Here on the left side of this picture you see a normal kidney, and on the right side you see an abnormal kidney. This is the polycystic. Poly meaning many, cystic meaning cyst. So this is what a polycystic kidney looks like. You can only imagine that causes a lot of trouble for that patient, even as simple as producing urine and getting that urine out of the kidney down through the ureters. That can be a problem with polycystic kidney disease. So we definitely want to make sure our patients are screened for that, or screened for that, not screened. I apologize. I'm just as human as you guys are. Diabetes mellitus is one of those disease processes that we see a lot of urinary signs and symptoms. We see a lot of polyuria, frequency, urgency. We also see polydipsia. The polydipsia means excessive thirst. So a lot of times with your patients that come in and they're complaining of polyuria, then we need to make sure that we ask about polydipsia as well, because that can help us treat the patient as a whole, not just looking at their urinary system, but their patient as a whole. Okay, so what is some of this information that's showing up on your screen now? A very big one that you need to remember is this nephrolithiasis. Remember, nephro is kidney, litho is stone, and then iasis is the condition. So nephrolithiasis is a condition of having a kidney stone. Very, very common term. Hopefully you never have that situation to occur to you. If you've ever had a kidney stone, you know exactly what I'm talking about. Not a very fun situation. There are different types of pathologies, such as growths that we will see within the bladder, and also in different areas within the urinary system. So urinary polyps are sometimes common with patients depending on what their medical history is, but we don't like to see those. We also can see these particular signs and symptoms in structures having problems called cystoscope. This is not fun. The stenosis is not fun. We have to remember that these are definitely some situations that we don't want our patients to end up having, and we definitely want to document if the patient starts to exhibit signs and symptoms of these particular situations. So here on your screen now you see urinary tract obstructions. Those can be from stones, those can be from strictures within the actual urinary tract itself, which causes problems. You can have narrowing of the tubules, which could be the ureters or the urethra. And as you can imagine, if things become strictured, then there's not enough coming through, which kind of makes a back up in the whole system, if you will. Alright, so let's keep looking at some of these different pictures and going through the text. The renal cell carcinoma, remember carcinoma is a cancerous tumor, not just a tumor, but a cancerous, because we say carcino. So you can see here, this middle structure that's really pretty in red is actually the kidney, but all this blobby stuff on the outside, especially this one here, this is fat over here, but this rounded part is actually a tumor. It has a lot of blood vessels feeding it, you can see, so you can't just go in and cut it and walk away. There's a very, very delicate type of surgery that we can do to make sure the patient doesn't bleed to death, but also to try to make sure that we get all of that tumor, that it does not continue to grow nor continue to give the patient any trouble. Here are a few pictures of cystoceles, and as you can see, the bladder is going to herniate through if we have the seal, which can cause a lot of problems. Okay? Alright, so let's look at a few other types of pathologies. We can talk about pyelonephritis and cystitis and urethritis. Remember, those are all going to be inflammation of those specific areas, and this is be very easy to pick out nephritis. So that's an inflammation of a nephron. Remember, those are the functional units of the kidneys. But let's look at some of these STDs that could cause problems. Remember, an STD is a sexually transmitted disease. You might hear it referred to as STIs, which are sexually transmitted infections. Those are very common in this area. We have the most common ones, which are gonorrhea and chlamydia. Those tend to cause a lot of trouble with our urinary tract. So we have different types of discharge that are noted with these specific types of STDs and STIs. We also have what is considered another type of issue, which is E. coli, which is a genitourinary infection that is commonly seen in females' urine. And you're sitting here thinking, why would we have E. coli in a female's urine? Well, the proximity of the opening of the urethra and the vagina in proximity to the anus and rectum is very, very close. So if you have patients that wipe their undercarriage from the back to the front versus the front to the back, then that's going to definitely cause some UTIs, especially E. coli, to show up in that urine. And this can cause some very sick individuals. This is not something that we play around with, so we've got to be careful, pick up on those different types of problems, report them, get those urine cultures processed and identify the specific type of bacteria and get them on the correct antibiotic. Okay? So here are some more terms that you need to be familiar with as far as prefixes, suffixes, and combining forms. This is always a very interesting thing to see and also to talk about. So we have hypospadias and epispadias. This is a situation that unfortunately can occur with our patients where, remember, when we say hypo, that means below or low. So the hypospadiasis is a congenital defect when that urinary meatus is located below its normal location. So it's not going to be easy for them to actually urinate. So rather than that urinary meatus being at the very end of the penis on male patients, it's on the bottom side. So that is very different to look at, and it sometimes can cause a lot of problems with urination. And that is one of those surgical procedures that needs to be considered. The epispadiasis, this is when the urinary meatus is located above its normal location. So in males, that would mean that the urinary meatus is on the top. So definitely those two urinary problems would be surgical candidates. We also talk about dialysis with a surgical and therapeutic intervention for the urinary system. Dialysis is a situation where we are removing the patient's blood and we're cleaning it through this huge machine that you see here on the screen and then putting the blood back into the patient. Why are we doing that? Is because that patient's kidneys can't do it themselves. So where normally a healthy patient can have their kidneys filtering their urine, unfortunately, or their blood, unfortunately this patient cannot, so we have to do it for them through this huge machine called a dialysis machine or a dialyzer. Now, what about our patients that end up having kidney stones? Well, there are different types of treatment for that. We can do lithotripsy, where we're taking all of these ultrasonic waves and we're focusing on the area in the kidney to bust up that kidney stone. And this is pretty cool. It's an outpatient procedure that doesn't take too long. And then there's also the surgical interventions where we can go in and actually remove that kidney stone from the kidney to help remove the obstruction or remove that kidney stone that's causing so much pain. Now, some of the other terms. Nephrostomy, ureterostomy, transureterostomy. We've got different types of procedures where we're ostomies. What are we doing with the ostomy? We're actually creating that hole so we can surgical puncture into that area. Then we also can remove that kidney if we needed to, which is a last resort. This is a great picture of a stone basket here on the right with the x-ray, where we go in and we use a special little instrument to remove that stone. What we do is we introduce this catheter and it pushes out a little piece of wire, and when you press on the thumb area on the handle, it releases this little bit of metal that forms a little basket, and you capture that darn stone and you pull it back through the catheter and remove it. So pretty cool procedure. I mean, I would not want to have it done, but it is one that they can do very easily. Okay, so let's try and get this particular system finished up here in the next second. One of the major types of surgical procedures that I want you to remember within the urinary system is called a TURP, T-U-R-P, transurethral resection of the prostate. Now, obviously, this is something that only a male patient can have because only males have a prostate. So what happens with that transurethral resection of the prostate? We're going trans, meaning across, through the urethra to resect the prostate because there's something going on with that prostate. And that basically just describes what happens with that TURP. This ends the lecture.